very glad that you have invested a lot of money and your energy, time in developing your career. Even though you are in MDS, you still manage to go for courses and update yourself.
The best surgeons are from Tamil Nadu, I feel. That's my personal opinion. If you have that skill in giving of the patient a good smile and good aesthetics, that is all we need any day. Initially, before coming here, I thought it was going to be a normal course by giving normal cases. But every case was different. Every case I could learn each and every step new.
Hello viewers, welcome to Malligai Dental Academy's YouTube channel. It's been a long time I spoke to you all. Today we have a special guest with us, Dr. Hari. He is a oral and maxillofacial surgeon. He is based in Cochin, Kerala, and he also completed his aesthetic medicine. And we have trained him on dental implants in advanced procedures like sinus grafting and prosthetic procedures. Doctor will tell his story now. Hello, Doctor. Namaskar.
Namaskar. Thank you, sir.
So thank you so much for coming to our academy. Tell me about your story. Like, when did you finish your BDS?
Sir, I completed my BDS from Manamla University from 2014. And after 2014, since the best surgeons are from Tamil Nadu, I feel. That's my personal opinion. So then I have gone and took a senior residency in maxillofacial surgery from Government Medical College, Alapi in Kerala. And then I've gone for my PG in 2016 from Yenapoya Dean to the University in Bangalore. And that is how my career from graduation till post-graduation got completed.
So
and
when did you finish?
My PG I've completed from Yenapoya and completed in 2019.
Okay, good. So tell me, Doctor, about implantology and oral surgery. How do you think, what is there in the mind of any oral surgeons about implantology?
That's a bit confusing question, sir, because if you take 10 oral surgeon, 5 will say oral surgery is good, 5 will say implantology is good. So it's always a mixed opinion among oral surgeons.
So why did you choose to learn implantology?
Initially, I was not having much interest towards implantology, to be frank, but then later I understood that if you have that skill in giving of the patient a good smile and good aesthetics, that is all you need any day.
I'm very glad that you have invested a lot of money and your energy, time in developing your career. Even though you are an MDS, you still manage to go for courses and update yourself. So why do you can tell some viewers who are watching this about the importance of upgrading themselves?
My frank opinion is, just by getting a course or just by getting a degree, you're not going to reach anywhere in your life. If you thoroughly update yourself and if you continuously try to educate yourself, and if you are going to be a student inside you, then definitely that is the only thing that you want in your life which will make you successful.
Great. Dear viewers, on 2nd of January, when I was traveling back from a native place after celebrating New Year, suddenly I got a call from Dr. Hari saying that doctor is going to go to Gulf country. He is going to settle down there and he wants to do a quick course on higher advanced procedures like sinus graftings. He wanted to do some kind of advanced procedures like digital implantology, full mouth cases and all that he was asking me. So, the time frame is very less. We had very less time. So we somehow managed him to give around 6 to 7 cases over this last 3 days, just Monday, Tuesday, Wednesday, on 16, 17, 18. That too, Tamil festival, Pongal was there. People were generally reluctant to come for the course. Patients generally don't come on a holiday time, but still patients turned up and doctor did excellently well. And today, we were very happy to tell that we did a nice direct sinus lift using an open method, lateral window approach, and we did a removal of some kind of cystic fluid from the sinus, and we managed to place one implant also. And doctor is very lucky to get one anterior case also in this deal. Generally for many people anterior case, they wait for a lot of time, but doctor got lucky and he got one anterior case also, because anterior implant placement is also a kind of a specialty in itself, I can say. So we will ask now his feedback about this course and how it helped him. Yes, doctor, among all these cases which I've told just now, tell me each and every case, like how it transformed you from day one to today.
Actually, every case was different, which I got from the course. Like, if you are thinking about just a normal course, initially before coming here, I thought it was going to be a normal course by giving normal cases. But every case was different. Every case I could learn each and every step new, so that if there is any complication that is going to come, it was very easy for me to manage. Being an oral surgeon, seeing to this gives me additional confidence, and different types of cases I would recommend. Not direct cases you should do difficult cases, you should fall in complications during the course. If you do it that way, then only when you go out, definitely you will have that confidence
So
in
you
it.
can tell the viewers what complication you faced when you did the course.
I faced while I was placing the anterior. See, I got different kinds of cases. Sir actually gave me varieties of cases, like one immediate extraction, one normal case, one failed implant case, bone loss case. So different kinds of cases were there. Everything in with his help and guidance, I was able to attain it. And during this anterior placement, since the position and the technique is little, you have to think a lot about it. You have to think from a 3D point of view when you are doing an anterior, when you're doing implantology, I would say. And anteriorly, what happened is the drill, actually, I have placed, the drill was correct, but then towards the end, when I was trying to do the implant actually moved on to another direction, which resulted in open defect on that area. So initially I got little panic, because seeing all on a sudden on an anterior implant, and that
Basically, what happened, doctor was doing osteotomy. I saw the osteotomy was fine, and I didn't help him. In that case, I was away. So what happened when doctor suddenly called me after the placement? He said, I'm not able to get the primary stability, and the implant is not placed in the right position, I feel. So I went and saw. I felt the implant was in a different position. It was quite deep into the socket. So when I explored the socket, and I opened the buccal flap a little bit, and I found the buccal wall was penetrated, and the implant was fully into the buccal corridor. For example, under the attached mucosa. You know what happened was, doctor did everything well. The thing is, the implant got slipped, and it went out of the osteotomy site, and it has started entering the attached mucosal area. So doctor couldn't recognize it, because his angulation was very different the way he was seeing. So I removed the whole implant. I showed him. I recorrected it and placed it in the right way. So the one lesson I told the doctor is, please face complication here, so that you don't face complication in your practice, because this is a training ground. Like when I worked in the army, they say the more you sweat in the training ground, the less you bleed in the actual war. So when you are doing courses, if you are facing complication, don't get discouraged, because in future it will be a warning bell. The point two for doctor, I told him is, anterior cases are very, very tricky, even for very, very senior hands also, because the best way to handle is take a guide and do. Because if you make a guide, since we are running short of time, we were not able to give him a guide. Otherwise, definitely we could have given him a nice guided case. But we overcame that today by doing a nice sinus lift case. Doctor did excellent flap reflection, because he's an oral surgeon, and also he did a nice window preparation using. We have a high Austen lateral window approach kit, lateral approach sinus kit, LAS kit, and our doctor learned it very well, and quickly he elevated the flap, and we made the window, removed the sinus membrane also. He could able to see the membrane moving and all that. And we collected some fluid which was there. Then we cleaned up that area, put a nice, and we will ask him one new procedure he learned today. Doctor, you harvested bone today using a tool. What do you think of the tool?
It's such a really, I would say, really a great tool, especially for an oral surgeon like
The
me.
tool is called micro os bone scraper. So doctor was very lucky, because in such a short time he was able to access to so many new gadgets, especially in implant augmentation field, where he was able to. We opened the flap, we got a lot of bone from the tuberosity area, and it was like a gold for us. You keep taking a lot of gold with so much of potential,
Yes.
induction potential. We combined it with the BIOS, and we nicely packed it. And in the screen we are displaying the X-ray also. You can see how nice the lift is. And we also luckily we placed a 5x10 aqueous neodent implant, Strawman neodent implant also. So how was the primary stability in that case, in such a small bone?
It was really great. I couldn't
Out of all the cases, just 3 mm of bone gave him almost 60 to 70 newtons of torque, nice torque. So, doctor, I'm very happy that even you did a lot of prosthetics.
Yes,
You
sir.
did crown delivery,
Yes.
jig trial, impression,
Yes.
and some complications of the other clinic implant case also
Yes.
came today.
Yes.
So, I'm very lucky and very blessed to have him as my trainee, and I'm a trainer for him. And if you all wish to come here for upgrading your implantology skill, it's like one-on-one coaching is very, very demanding because we have to spend our valuable time focus fully on you. Our team has nicely arranged all the cases in the schedule, and luckily, doctor came very early in the starting of this year itself. It's giving us a good motivation that future batch will have more technology. And one more thing, doctor, before I forget, what about the digital technology we use? Did you see the way we did a lot of scanning?
Exactly, sir. Digital scanning, all these will save a lot of time for us, and it gives an exact clarity of the impressions.
When you joined the course, did you ever thought that you will be able to see this many exposures?
I was not having any expectations regarding the prostho side, but then because of you and your effort, it actually turned me towards doing that as well. It helped me to understand that this is only this much. So if you do only, you will be able to understand. Without that,
yeah, lot of doctors are very, very skeptical about understanding the implant prosthodontics. So, doctor was a surgeon. Generally, there will be a stigma. I'm a surgeon. Why I have to focus more on prosthetic? That is there a normal trend. But the doctor, even though he learned everything, and it was an awesome that he did a lot of cases like jig verification, impression, everything he did nicely. I'm so glad, Hari.
thank you, sir.
And a few more questions like when you were looking for academy, though you are in Cochin, you are in Kerala, there are a lot of courses happening there everywhere. How did you choose me to come?
Actually, sir, I have got other opportunities as well. But then that what made me differ from that to your academy is I told you that I need these things. First thing that you told me is that don't worry about it. Just come. I will make sure that everything will be completed at the rest. And this I'm saying at the last that I actually got what I needed. And that is one advantage that I felt here. And the team was really great. The doctors were really helping me in and out regarding everything. They were just standing behind me and helping me out from the scrap.
Yes. And also one of my team doctor also was doing a course starting from Dr. Hari, because she also wanted to start placing implants, and she did I think one case and couple of cases. Though she is very good in prosthodontics, surgical part, I told her to join and keep placing implants. And I'm very glad, doctor, that you are more than happy and you are very, very satisfied. And when you're going fruitfully, because doctor drove all the way with his wife from Kerala to Chennai, driving is very long. So he drove all the way and he got what he wanted, and he's going back with satisfaction and fulfillment, right, doctor?
Yes, sir. Yes, sir.
So, dear viewers, this academy is fully focused on making you a great success. So, because I want all of you to enjoy success, enjoy gratefulness, and enjoy fruitfulness in your career using our dental field. Dr. Hari, is there anything you want to tell our viewers?
I would definitely recommend you continue your upgrading and make sure that you learn courses. Make sure that you get updated yourself all the time. That is the only way to success. Thank you so much.
So, thank you for your patronage to our academy. Please recommend us
Definitely.
to your friends, and even in abroad country also. If there is an opportunity, we'll try to work together.
Sure,
Thank you and God bless.
Thank you.